State of Affairs is pleased to welcome once again Dr. Shereef Elnahal, who's the Commissioner of the New Jersey Department of Health. Good to see you, Commissioner.
Thanks for having me, Steve.
We're taping on the 13th of November. Things will evolve quickly. Our partners here at NJTV News will cover this story on a regular basis. It is the adenovirus outbreaks up at the Wanacue Center. 10 children, as we are speaking right now, have lost their lives. The role of the Department of Health here is?
Well, it's really a tragic situation, Steve, and our role is to assist the facility as much as possible in making sure that they contain the virus as much as they can. We don't have as many tools for adenovirus as we do for other types of outbreaks. There's no cure medicinally, there's no vaccine. It really depends on every staff member for every patient following all the protocols, having gowns, gloves, washing hands thoroughly for every patient. And that's what we're making sure they do, both in assistance, but also enforcing those standards through our mechanisms.
One more follow-up question on this. Is there a reason why the rest of the state of New Jersey, particularly those of us with children, need to be worried?
This is not a risk to the general public, Steve, thankfully. This is not normally a virus that causes severe illness in folks with normal immune systems. Unfortunately, at this facility, you have a lot of medically fragile children.
Their system's compromised, their immune system.
Exactly. The immune system, the part of your body that fights infections. And these children, it's compromised relative to the general population. And so they're particularly at risk, which is why you're seeing a lot of the bad outcomes.
If you're listening to us on the the radio side, Steve Adubato here, State of Affairs with the Commissioner of the Department of Health. Dr. Elnahal, let me ask you this. Let's talk about the whole question of, and again, timing's interesting here as well. There are these open enrollment periods as it relates to the Affordable Care Act, otherwise known as Obamacare. There's an initiative, and we'll put up on the screen right now. It is called Get Covered NJ. What is it, and what does it have to do with getting covered?
I really appreciate you asking about that, Steve. It's a really critical time for people to get coverage, especially for those who are uninsured. We have a lot of options available to folks. This is open enrollment period for the Affordable Care Act.
What is that period exactly?
That period is from November 1st through December 15th. It's a 6-week period.
So if this is seen after, if this edition of State of Affairs is seen after that, then what?
So that's why we're really trying to get the word out as much as possible. We have a website out there, getcovered.nj.gov,
right.
That really allows folks to get on and see all of their options in a really simple and easy way. And we have some of the benefit of the Governor Murphy's policies that have made these plans even more affordable this year than they have been. 10% lower premiums on average than in previous years, thanks to work of the Department of Banking and Insurance, our department, Human Services, and getting the word out. And the governor is very committed to getting as many people as possible enrolled.
Let me ask you, Commissioner, when it comes to autism, this is an issue that you and your colleagues have taken a great interest in. The New Jersey Autism Center of Excellence, what is it? Its connection to Rutgers University, why does it matter to everyone in this state?
Yeah, so autism is a really important problem, especially in New Jersey. Arguably, we have some of the highest rates reported because we are among the best states in the country in recognizing and diagnosing autism. And what centers like this do, what our Council on Autism does out of the department, is allows for better clinical care and more research going forward in how to fight autism and prevent it. And so that's what these organizations do.
By the way, check our website, which will be up right now. We're doing a comprehensive multi-part series on autism, how prevalent it is, how the state is dealing with it, how not-for-profit organizations are dealing with it. But my question is, because you're a medical doctor, you understand these issues very well, how prevalent is autism?
Autism is a lot more prevalent than you think. You have a lot of children that grow up without a diagnosis because parents don't know about the signs to look for. And that's why it's important to get as many people access to a pediatrician and folks who are able to help and give assistance to families as possible. And so New Jersey is far ahead of other states. We have a lot more room to go in fighting autism, and Department of Health is front and center in that.
Final question here. How early can you think it's realistic to potentially recognize the signs that a child has or is somewhere on the autism spectrum, if you will?
You can recognize them pretty early. There are a lot of milestones for normal social development, the ability to smile and respond to family members, to parents. All of those things can be recognized early. The diagnosis comes a little bit later. But having a regular follow-up with pediatricians that's looking for these milestones really helps.
Commissioner, again, having a health commissioner with a clinical background matters. The opioid crisis in the state. There's thinking here that there is a way to help those who are dealing with opioid issues, who are addicted to opioids, with cannabis. Help us understand that initiative and the clinical thinking.
Oh, absolutely, Steve. First of all, there are actually studies out there that show that medical marijuana is an effective replacement for opioids in pain control. As part of the governor's reforms in our medical marijuana program, we've added pain as a diagnosis for which people can get medical marijuana. Pain is a tricky problem to treat. You only have on one side your Tylenol, your Advil, medications like that. On the other side, you have opioids with all of those risks associated with it, and you don't have as much in the middle. Medical marijuana is a very effective treatment for pain. It's also much lower risk for opioid treatment. We're also considering it as an addition to medication-assisted treatment, which is the evidence-based standard of care for opioid addiction, to have medical marijuana come in as an adjunct, as an addition to that therapy to help people bridge into recovery who are addicted.
We actually kicked off our series called The Future of Healthcare in New Jersey and the nation with the commissioner a few months back, and we're continuing that conversation by talking about a range of issues. You see the chyron there that makes it clear that this is part of the future of healthcare discussion. So I'm curious about this. I asked you about this once before. I'm going to ask you again. One of the other initiatives we're involved in has to do with, it's called Right from the Start NJ. The site will be up right now. It's dealing with infants and toddlers and their needs. Now, there's a whole child care issue that we deal with other colleagues in the administration about, Carol Johnson and others. But from a health perspective, birth to 3 matters so much because?
It's a really critical time for development, Steve. These are the times when a healthy relationship with caregivers and family members means so much for the development and functioning of children as they grow up. Reading to your children is so important for their brain development. There are studies that show that simply by reading to a child every night, their performance in school, their performance professionally, all of that really, really matters. And so emphasizing what parents can do, what families can do during that critical time frame is really important.
1 minute left. What have I missed? 2019, top 2 or 3 goals?
Really want to make sure we enroll as many people as possible in the Affordable Care Act, as I mentioned, getting more people access to medical marijuana, and finally tackling the opioid epidemic, which is affecting so many lives.
Real quick, go back on this. The whole question of open enrollment, does that mean if it's not the open enrollment period, like post, not like, but it is post December 15th, you cannot enroll?
Yeah, the enrollment period closed, and unfortunately, the Trump administration truncated the time frame. They shortened it.
And they also didn't they reduce the amount of funding for advertising and promotion and public awareness?
They did, and in response, the state has tried to fill that gap by funding navigators much more generously, and you have multiple departments engaged in that. So we're trying to fill in a gap that was purposely put in place by the Trump administration to get more people.
Real quick, before I let you go, does it open up again at a later point after the 15th of December?
Not until next year, which is why this critical period is so important for people to enroll.
Commissioner Shereef Elnahal is Commissioner of New Jersey Department of Health. He has a huge job, and I want to thank you for joining us in State of Affairs once again.
Thank you, Steve.
I'm Steve Adubato. Thank you for watching this edition of State of Affairs. Follow me on Twitter at Steve Adubato. Check you out next week. Thanks so much. Thanks, Commissioner.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by the Turl Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, New Jersey Sharing Network, Holy Name Medical Center in Teaneck, New Jersey, New Jersey Resources, Keystone Mountain Lakes Regional Council of Carpenters, and by Guarini Institute for Government and Leadership at St. Peter's University.